So let's start with President Trump's plan. How does that differ from what state and local leaders are doing in terms of lockdowns and social distancing?
So right now, I think the focus really is on what are the steps we need to take before we can actually open the economy. Before we can ever even think about reopening the economy, we need a lot more information. And we need to move from the diagnostic testing we've been seeing toward widespread random testing. So at this point, we're using testing when someone comes in with symptoms that are indicative of COVID to confirm whether or not they have the COVID virus. What we actually need is to get a measure in the population of what the infection rate really is, how many people have actually gotten it and recovered, so we can have a more sort of carefully measured version of the serious infection rate and, frankly, the mortality rate. Knowing this information is the first step we need to take before we can actually think about opening the economy.
So then how realistic is this next deadline of late April for restarting normal affairs based on the trends that we're currently seeing?
I mean, based on the trends we're currently seeing, given the fact that we don't even have a good measure of the infection rate, it's very hard to believe that we're going to be out buying coffees in 2 weeks. I think this is going to last some time. I would like to talk a little bit about why I think this economic moment is a bit different than a typical recession. Most recessions, are characterized by a decline in corporate investment. This is very different. What we've seen is a hard freeze in all aspects of the in-person economy. And what's different about that is, unlike an appliance or like a car purchase that a family puts off during a normal recession, the restaurant meals and haircuts we're skipping now aren't going to be eaten later or had later. This is much more like a natural disaster, frankly, than like a typical recession.
So then, given that distinction then, will a recently passed stimulus be enough to hold over the average American family until then?
So I actually think the stimulus is surprisingly good, if just a first step. What we need to do, right, in a moment like this where we've actually put a hard freeze on the economy, is we need to send support out to individual families, right, so that they can pay their rent, they can feed their families, which is incredibly important right now because with the schools closed, families that really depend on free and reduced price lunches through the schools can't get them right now. So for low-income families, those stimulus checks and the unemployment benefits are going to be crucial. On the other side, we actually also need to be supporting businesses. And the stimulus does have large-scale loans available to medium and large corporations. And for small businesses, what's really great in the stimulus is that those loans will be forgiven if they keep their workforce intact. That is, if they don't engage in layoffs. Right. So we're really taking measures to keep the underlying economy intact while we actually have this freeze going on.
Now, obviously, President Trump very eager to get the economy back on track, but nobody wants to jump the gun and be wrong, only to have infections rise again. So what's the most responsible way to reopen? Would it be by regions, by sectors, or perhaps people's personal health requirements?
I think it's going to really depend on regional infection rates, right? Like if we had a world in which travel is curtailed to some degree, and in some areas there are low infection rates, you could consider, having a policy where those who are vulnerable are kept quarantined, they self-quarantine, and some parts of regular life can come back. But I think really we're a ways off from that. I think we're a ways off from seeing the full spread of this virus. What is really different about this economic moment is that a lot of things we're worried about during recessions don't apply here. In some ways, policy is actually a bit simpler. Usually when we think about sending, cash payments out to families, we worry, as economists in particular, about what kinds of incentives we're creating. Right. If we give people cash, are they really going to want to work? Right now, they can't work. So we really can just send them income support until it's safe for them to be out and about again.
Now, I do want to touch on this because obviously this has been such a huge shock to this system that's caused all of us to rethink how we work, how we study remotely, how we interact with each other, as well as a reality check on our spending priorities. So what sort of long-term economic effects do you think this could have after the pandemic?
Well, I think for a lot of families, savings are quite scant. And for many families, it's very difficult to save given their incomes, but I think we may see a new commitment to saving going forward. When we think about sectors of the economy that could change, recessions are often times where we see shifts in the way firms do their business. We often see firms moving away from human labor, from workers, towards automation. And this could be a moment, especially when the risk really is the people, you'll probably see some impulse in the business community to find ways to automate. And I think that could be one of the longer lasting impacts of this particular economic sort of freeze.
All right, well, thank you. We do appreciate your insights. Nirupama Rao there, Assistant Professor of Business, Economics and Public Policy at the Ross School of Business at the University of Michigan.